Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, February 23rd, 2021. So around the world and here at home, case counts continue to decline, or at least the rates continue to decline, with 2.5 million new cases worldwide, which is about 400,000 fewer than the week before. Here in the United States, we saw about 500,000 new cases, which is about 200,000, less than the week before. And here in Massachusetts, about 11,000, which is a drop of about 5,000 from the previous week. In terms of deaths, worldwide, we saw about 85,000 additional deaths. Here in the United States, that was 14,000, but we did cross a major milestone there at 500,000 deaths from COVID-19. And here in Massachusetts, we saw 336 new deaths from COVID in the last week. So it's about every metric continues to decline this week, including, unfortunately, testing, which has dropped significantly. Case counts are low. We are now getting consistently below the levels of the summer surge, which is good. It's still, thinking about back in August when that was the highest of the highs. It's still not great, but it's still progress. Hospitalizations are just about also reaching that same point, summer surges, and deaths are perhaps slightly plateauing due to some data issues coming out of places impacted by the storms in Texas and so forth. But looking around the country there, you can see that most areas, especially the South and West, have dropped off significantly. The Northeast is going a bit slower than the others. These are cases by population. And part of that may be, of course, the fact that the South and West are going to generally be a bit warmer than us here. So there's a lot more room for outdoor activity than we certainly have, which can certainly reduce case counts a lot more quickly. Hospitalizations have also been dropping, about 40 straight days of decreases in hospitalizations. This graph shows the net gain in hospitalizations day by day. And as you can see, we've now had basically 2 months in a row of steady decreases here. The light blue are all days when there was more people discharged than admitted. And of course, there's probably deaths factored into this as well, unfortunately. But as the net census in hospitals decline, and we're basically at a mirror image of where we were in November and December here, which is pretty good. Deaths are also slowly declining, but again, these move a lot more slowly. And we'll probably see a lot more interruptions in this from the Texas storms, just because the time to log a death actually takes a surprising amount of time. But these are also moving a bit slower. However, there is some good news on this front as well, as we look at our long-term care facilities, which previously accounted for a significant amount of our cases and deaths. These show the cases, deaths, and outbreaks in long-term care facilities over time. And this is actually the first place where we are seeing the vaccine take effect. So you can see it perhaps most notably here on the left. We have the weekly cases in long-term care facilities, and vaccination there starts in late December, and you can see that steadily drops off there. Weekly deaths also, there's a number of irregularities due to holiday backlogs here on the days that have a asterisk, but we'll see that corrected in a moment. And also, perhaps most importantly, these are the facilities with new outbreaks. And fewer outbreaks means fewer cases, means fewer deaths. And you can see how that drops precipitously after the vaccines start coming into play there. So that's just much fewer circulating cases, fewer outbreaks there. When we look at deaths, though, adjusted for those backlogged data points, when perhaps a state after a holiday released a bunch of deaths in one particular week, which throws off the numbers. This shows how it steadily declines since the vaccines were introduced into long-term care facilities, dropping off significantly. In fact, and we look at it as a percentage of all deaths from COVID, week over week, it was steadily in the 40s and 30s percent. In the last week of December, 35% of deaths in America came from long-term care facilities. And then you can see that was 2 weeks after vaccination began. And as that started to spread through, you can see there's just been a very steady decline there of the percentage of deaths that were in long-term care facilities. As these places get the vaccine first, that's exactly what we should expect. And it's very heartening to know in about a month and a half, the death rate fell basically in half, which is pretty good. It actually probably fell even more than that when you consider the death rate as a whole has gone up in that time. But still some very promising results for the vaccine in the real world. We'll look at some more of that in our development stay. But first, it's worth pointing out another milestone we've passed of 500,000 Americans have died from COVID-19. That's more than World War I, World War II, and Vietnam combined. Staggering number. That's an entire major city gone. And it's a difficult thing to process. It's very easy to make that a statistic, but it's just a huge number we'll look at again quickly before we leave. In better news, the FDA said that booster shots to combat COVID variants will not need lengthy clinical trials like the ones we saw in the fall. Be able to come out much faster as a result because most of the safety data is already in on them. It's exciting because Moderna and Pfizer say they can get a booster shot in about 6 weeks. Of course, there's much more time for manufacturing after that, but that's the actual development time from when they start actually trying to have one to when it is ready for manufacturing. It's just 6 weeks. That's a very fast turnaround in order to get booster shots out there should we need them. Also, some new studies coming out showing how the vaccines are performing in the real world. It's always really interesting to see how vaccines really work when we actually put the rubber to the road. We're not just looking at this in a lab or on paper. First up, in Israel, it was determined that Pfizer vaccine had an 85% efficacy after just the first shot, which has huge implications going forward for mass vaccinations across the world when supplies are short. On that same note, AstraZeneca vaccine showed better response after 3 months for a second dose instead of 6 weeks, which is also huge because it gives you reason to hold back the second dose, which makes it easier to get doses out to everyone across the world. You can give people their first dose and then 3 months later come back with a second dose. It means you have much more time to give people their first doses. And we don't know if it's going to be quite as effective on the first dose as the Pfizer was. Moderna one is probably going to be similar to that, but still very exciting news there. In terms of vaccinations here at home, here in the United States, 75.2 million doses have been sent out. Here in Massachusetts, we have 1.7 received. That means that 64.1 million vaccinations have been given in the United States, 1.4 of those here in Massachusetts. And that means that 44.1 million Americans, accounting for 16.9% of the the adult population, have received their at least one dose. In Massachusetts, we have just crossed about 1 million people receiving one or more doses. That's 19.3% of the adult population. I'm using the adult population there because the Moderna vaccine is only authorized for people 18 plus, and the Pfizer is 16 plus. So this is just looking at the people who are actually eligible to get the vaccine, not the entire population that we can't actually yet give a vaccine to. There are a couple of 17-year-olds who have gotten the Pfizer vaccine, but it's a very small amount for the scale we're looking at here. In terms of second doses, 19.4 million Americans have received their second dose, and about 382,000 people in Massachusetts have gotten theirs. So that's, that we are still moving a little slowly there, but progress is ramping up. We're doing about 1.6 million vaccinations per day, and that is likely to increase. You'll see that here in Massachusetts, about almost 20% of the adult population has gotten a vaccine right now, and that is a pretty good start, honestly. So as we go into the week, one final thought. I usually like to make these something cheerful, but I thought that we should really take a moment to reflect on the milestone we passed this week. So here is just a number of cities that have a population of less than 500,000. This was a graphic from the Daily Beast today, and just showing that just the scale of how many people we've lost is the entire city of Miami. So that is Pittsburgh and Salt Lake City combined. It's just a huge amount of people we've lost, and it's it's something that we really do have to reflect on and process, and not just let this slip by us as a statistic. And for the sources on these, we have the COVID tracking project, the CDC, mass.gov, and the New York Times. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.